Very good evening, everyone. I am Dr. Abhishek Parolia, Head of Clinical Dentistry Division, and on behalf of IMU School of Dentistry, I would like to welcome you all for the virtual postgraduate info week. And today we have a few speakers for all of you. So currently we are having 3 postgraduate diploma courses, which is one of them is postgraduate endodontics. Postgraduate diploma in endodontics is led by Dr. Shekhar Bhatia. Then we have PGD Pros, which is postgraduate diploma in prosthodontics, which is led by Dr. Praveen Patil, and PGDID, which is postgraduate diploma in implant dentistry, which is led by Dr. Ranjeet Bapat. We also do have industry partners with us. So today we have from Carl Zeiss, Denise T. The representation from Dentsply Sirona is Ms. Cheryl Wong. And then we also have from Noble Biocare, Ms. Elaine Tan. We do also have a couple of our students and alumni. So you will be listening from them because we are running PGDID, which is implant dentistry course. So we have Dr. Karthikeyan, who is currently pursuing PGDID course, and also Dr. Karpaham, who is an alumni for PGDID. So I hope all of you can enjoy this. But for before we start, and I invite the speaker, the first speaker, I do have some housekeeping rules. All of you have been muted, so your microphones are muted. However, you can have Q&A. If you have any question, you can always use the Q&A panel. And this live webinar is recorded. So let's enjoy the webinar, and please feel free to ask questions using the Q&A panel. So I would like to invite our first speaker, Dr. Shekhar Bhatia, who is the program director for PGD Endo. So Dr. Shekhar.
Okay, thank you, Dr. Abhishek. So I'll just share my screen. Yeah. Is it seen?
Yes, yes.
Okay, thanks, Dr. B. Thanks, Dr. B again. So good evening, everyone. Welcome to virtual postgraduate info week. So myself is I'm Dr. Shekhar. I'm a program director for PGD Endo. So I'll be talking about our course, which is a postgraduate diploma in endodontics. So just to quickly tell about myself, basically I did my graduation BDS from Manipal University. I finished in 2006. Then after that, I did my master's in endodontics in Rajiv Gandhi University, which is in India. Then I did my Royal College of membership in Glasgow and Edinburgh in 2019. I was working in India for 2 years, close to 2 years in one of the university. Then this is my journey. Basically, you can see that. Then I was actually working as a lecturer in Master University before I joined IMU. And I'm working in IMU almost for last close to 7.5 years. So presently, I'm leading on postgraduate diploma in endodontics with my team members. And I'll be talking about this program. So basically, this program is a sort of 1-year program. It's a diploma program in endodontics. So this covers knowledge acquisition through face-to-face and online lectures and a case-based discussion. So it's like a blended, basically, in the sense like most of the activities are face-to-face. So you'll be with us in the campus. For every module, first week you have to be with us, and then the rest of the weeks it's like a flexible. Okay. So there will be a lot of activities like, as I mentioned, there'll be lectures, there'll be case discussion, there'll be seminars, and a lot of tutorials. And then we'll be having a skill-based, which you're practicing in your our simulation lab. And then you'll be obviously doing cases under the supervision in IMU Oral Health Center. So this basically is a program which is designed for full-time and a part-time student with a respective flexible option. So this program is actually designed in a way thinking about the general practitioner who are practicing in Malaysia, or so it's like a flexible program. You can continue your practice and you can still enroll for this program. So this program actually has 6 modules. So comprising 2 semesters, sort of. One semester have 3 modules with the 17 weeks each. So total is like 34 weeks. It has a total of 30 credits delivered over a period of 1 year. As I mentioned, all your face-to-face and the teaching and learning activities will be completed in first year, though you can get an extra option or extra time to complete your clinical cases. So the duration of each module is approximately 5 to 6 weeks, including 1 week, as I mentioned, of a compulsory on-site. So basically you have to, for every module, the first week you have to be with us, in which you have to do face-to-face activities in IMU campus. And as I mentioned before, for the clinical activities, you have an option of either doing your clinical cases in IMU Oral Health Center, or you can actually do your clinical cases in your own practice under the supervision. Sort of, you have to discuss each and every case with your supervisor. So you'll be provided a mentor where you can discuss each and every case with your supervisor. So coming to the modules, there are 6 modules in this program. The first module is Fundamental Science in Endodontics. The second module is Endodontic Management of Single-Rooted Teeth. The third module is Endodontic Management of Multiple Rooted Teeth of a Moderate Difficulty. The fourth module is Rotary Endodontics. The fifth module is Management of Endodontic Cases requiring a multidisciplinary approach. Then the sixth module is Management of Failed Endodontic Cases in a Single-Rooted Teeth and Endodontic Mishaps. So as you see, it goes from the basic and then it goes up to a bit higher level. We have a very experienced teaching faculty. We have Dr. Abhishek. He's our moderator as well. He's very experienced in endodontics. He's, you know him probably. And then myself. Then we have Prof. Xiao, who is going to be our new dean. And we have Dr. Jack Lam, who is a private practitioner. He's a very famous private practitioner. He's like an endodontist. And then we have Dr. Sultan Omar Sharif. We have Dr. Kiran. We have Dr. Swarna. We have Dr. Preena. And so this is our teaching faculty in IMU. Our facilities in IMU, we have a campus in Bukit Jalil. We have our oral health center where you will be doing your cases if you opt for doing your cases in IMU. Then you'll be provided microscope, dental operating microscope, both in your simulation clinic as well as oral health center, where you can actually practice, and you have a flexible option of doing your simulation clinic. Even if you have some time, you just need to book your clinic, book your place and your station, and basically you can use your operating microscope. Then we have a facility of CBCT. Everybody knows that how important CBCT is in endodontics. So we have this. And the most important thing is this program, which is a diploma program, which is the only diploma program in endodontics in Malaysia so far, which is recognized by MQA. So whatever the activities, whatever the things we'll be doing it's all under the guidelines of MQA. Now coming to the assessment part, as it's shown, after module 3, you need to submit the case report. How you have to do it, we'll all guide you. All our team members will guide you. Plus, after every module, like module 3, module 4, module 5, you have to submit the case report, which carries the marks, which carries 10%. Every case report carries 10%. Then after module 3, there will be a written paper, which has a OBA and SCQ. OBA is one best answer question. It's something similar to your MCQ, and then a short answer question. And then after module C6, once you have completed your the quota of like 25 cases, and you have submitted the logbook, you are eligible to sit for the examination, which again carries your OBA, SCQ, and OSCE. So total is like 100%. And then along with that, you will be having a lot of formative assessments, sort of like, you need to present seminars. Then later part of your modules, you need to present your cases, which is like a part of your formative assessment. Yeah. Thank you so much. And if you have any Q&A, if you have any questions, we are most welcome to answer.
Thank you, Dr. Shekhar, for your brief summary of the entire program. And we will encourage participants to ask questions if they have any queries. However, while we are waiting for their questions, can I ask you a few questions on their behalf?
Yeah, sure, Dr. Abhi.
So I do understand that this is a 1-year course. So can you please tell us more about how many cases do we need to finish if they join us?
Yeah, okay. As I mentioned, yes, you have to complete total of 25 clinical cases, which can be a mixture of anterior, premolars, and molars. And it's like a sort of a logbook which you need to submit the logbook of 25 cases before you are eligible to sit for the final examination.
And how about these cases? I mean, these cases need to be done in IMU or can it be done in the private clinic
Yeah,
where they are working?
yeah, you can actually do it in IMU or you can actually do it in your own practice, provided you follow all the guidelines and you discuss your case with your supervisor.
So will these cases be provided by the IMU?
IMU won't promise that we can provide all the cases, though we will help you definitely, but we can't promise. Obviously, we encourage you to get your cases. If you have your friends in KL, if you are doing some locum or you're practicing in some clinics, you're most welcome to get your cases in IMU and do under the supervision. And you will be providing a supervisor who can guide you for each and every step.
I Another question for you, Dr. Shekhar. This is a very interesting concept, especially for general practitioners, those who are practicing. But what if we are not able to finish our cases in 1 year? So do we have any flexibility here?
Yes, Dr. Abhi, definitely. We are providing the flexibility. As I mentioned, that you can actually complete your cases depending upon your own flexible time. You can actually take extra year to finish your clinical cases if you're opting for a full-time program. I just want to clarify basically if there's any confusion between full-time and part-time. Basically, full-time and part-time, all your teaching and learning activities will be still done under 1 year, that first year, and the rest of the time you can extra year or you can even extend it to 3 years or 4 years depending upon to complete your clinical cases.
Thank you so much. And the last question for you is, how about the international candidates? Can they join us as well? Because now we are having COVID issues. So do you think this course is open for the international candidates?
Okay, the only issue in though we have actually initially when we were making this program, it's for the even for the international candidates. The only issue is about you cannot go up and down to your country. So the visa, if you are opting for this course as an international candidate, you have to stay in Malaysia. You cannot go up and down to your country because immigration, the visa which you're going to provide, it's not like you can do entry and exit. So that's the only issue.
Thank you, Dr. Shekhar. To add on this part, I can add in as well to those participants, those especially who are listening to us from international venues, that we do need international students to have their license to work in Malaysia. So if you don't have practicing certificate, you may not be able to do patients in Malaysia. Therefore, we may not offer this course to international students at this moment. However, we do have short courses where you can come here for 4 or 5 days and you can join our short courses where you will not be getting the 1 year diploma degrees, but you will be getting a certificate for the joining and the participation.
Yeah.
So if anyone is interested in endodontics, you can join us as a diploma, especially for Malaysians, and for international candidates, you can join us as a short course, which is going to run for 3 to 4 days.
Yeah,
So
agree.
thank you so much, Dr. Shekhar. I don't see any further questions. However, if any questions are there, we will get back to you.
Yep.
So now with this, I would like to invite our industry partner, or I think I will go ahead with the next speaker first, and then industry partners later. So the next speaker is Dr. Praveen Patil, who is the lead for postgraduate prosthodontics. So PGD Pros, postgraduate diploma in prosthodontics, and Dr. Praveen Patil is a prosthodontist and implantologist. So Dr. Praveen, I welcome you here, so you can go ahead.
Yeah, very good evening. Thank you, Dr. Abhishek. Thank you, Shekhar, for updating our PG Endo diploma course. So today I'm going to share a couple of pieces of information about the postgraduate diploma in prosthodontics in IMU, which we are going to start in June 2021 this year. Yeah, so let me just get back to share the screen. Okay, so this presentation will be myself, Dr. Praveen Kumar Patil, as a Program Director of PG Diploma, and we have our industrial partner from Dentsply Sirona, Ms. Shirley Wong, who is a Senior Sales Specialist here. Okay, so to start with my presentation, a couple of pieces of information about my own journey as a prosthodontist. I did my Bachelor of Dental Surgery in 2003 in MGU Dental College, Nasik, and done my Master's in Prosthodontics from Government Dental College and Hospital, Nagpur. Then I went to Tokyo Dental College for IPS JPS Scientific Exchange Program, and I did my MFDS from RCS Edinburgh and Glasgow. Well, I was before coming to IMU in 2014. I was working as an assistant professor in prosthodontics in GDC Nagpur, Government Dental College and Hospital Nagpur. And later on in 2015, I have become a examiner for Royal College of Surgeons Edinburgh's Diploma in Implant Dentistry exam. I am also involved in a founding member of IPS Council of Prosthodontic Research from Indian Prosthodontic Society, and I am working as an adjunct professor in prosthodontics in Pune and Nagpur. I am also a current editorial board member of Journal of Prosthetic Dentistry and a managing editor of International Journal of Prosthodontics and Restorative Dentistry, and the official speaker of International Team for Implantology, and a national ambassador for reviewer credits for Malaysia. Well, so this program, as Dr. Shekhar also as earlier mentioned about, is a flexible learning option, and the curriculum is set in a way that within 1 year of a learning span, the curriculum is designed to enhance the knowledge and skill in providing the evidence-based and patient care prosthodontic treatment of partial and complete edentism. We are starting in June 2021 this year, and so why you should study postgraduate diploma in prosthodontics at IMU is because of this is our first diploma in prosthodontics which is accredited by Malaysian Qualifying Agency. The modular system, we have 6 modules. I'll be talking a bit more in detail later on. We'll be giving you a flexible learning option, and then we have also a full-time as well as part-time option in addition to the flexible learning modular system. And we have a mentoring system to support the learning of the student, individualized learning for a particular student. And then we have a library facilities, hard copies, e-journals and e-books, all available for students at their request, and actually is available all the time. Okay, so a little bit about our program structure. So this program is going to be for 30 credits with 6 modules, and each module will be divided into 5 credits. So semester 1 will be of 6 months, semester 2 will be of 6 months, and then our module 1 will be of fundamentals of prosthodontics and patient-centered care. Module 2 and 3 will be all about partial edentialism. The module 2 will be learning more about fixed dental prosthesis, replacing partial edentulous cases, and then module 3 will be module 2 will be in partial prosthesis, and module 3 will be fixed dental prosthesis, replacing partial edentulism in that sense. In semester 2, we have module 4, 5, and 6. So module 4 will be all about complete dentures, and module 5 will be multidisciplinary approach towards managing prosthodontic cases. And module 6 will be about management of complications and failures in prosthodontics. Like earlier Dr. Shekhar has mentioned, we do have a full-time and part-time option as well. So full-time option works like after 1 year, minimum 1 year, you have to finish all your 10 cases in prosthodontics, and you are eligible to give the exam. However, if you do take an extra additional year to complete your cases, we have another extra year to complete your cases before applying for exam, before sitting for exam. So this is all about your full-time option. Part-time option, you will be giving exam after 2 years, and you have additional 2 years to complete your cases. So you have within first 2 years, you will be appearing for exam to complete 10 cases, If you cannot do that, you have additional 2 more years to complete the cases. So that is a part-time option for you to choose, and that's a pretty much flexible. You can shift anytime with the Senate approval from IMU. And we also do have different teaching and learning activities, face-to-face lectures and online learning activities and seminars, case-based learning, task-based learnings, practical hands-ons and clinical sessions as well. Yeah, so our teaching faculty for PGD Prosthodontics has an international acclaimed faculties, including our own Professor To, Professor Xiaoliang Ling, myself, Dr. Praveen, and Dr. Mandakini. We are all working here as a full-time prosthodontist. We do have our visiting lecturer from Nagpur, India, who is certified digital dental academy person from Berlin, who has done this and who is leading the digital dentistry in India as well. So he will be also coming for 1 or 2 modules to teach all about the digital dentistry. We have Dr. Shivani, Dr. Rohit Menon, Dr. Insi, and Dr. Nafis also as our eminent prosthodontists on board, and all are full-time prosthodontists and implantologists who are also fully available for you to get guidance from. So all talking about the facilities, we have a full pack of dental skills lab. We have a technology lab, dental technician lab. We have a full-fledged oral health center, which is running, of course, a library, and we have surgical rooms as well to manage the cases and so on. Okay, talking about the facilities, there is no program which is really going without the latest technologies. We have the line of state-of-the-art facilities, including cone beam computer tomography machine, CBCT machine. We have digital planning software. We have intraoral scanner. We have CADCAM facilities in our own lab. We have intraoral microscope, and we have ITI Online Academy Campus. So ITI Online Academy Campus is one full-fledged resource all about dental implants. If you want to learn a bit more about the dental implants and all, so we have a full peer-reviewed content from the experts from ITI, and that will be completely free of cost for all your students who will be joining this course as well. Assessment structure pretty much same as the PGD Endo program. Like in module 3, 4, and 5, we'll be having case report submission 1, case report 2, and case report 3. That will be including 10% each of total of your valuation weightage. And then we do have in module 3, we have a written paper, which is like a in-course assessment, including OBAs and SAQs. At the end of module 6, once you have done your 10 different cases, you have a written paper and including OBAs and SAQs, and you have OSCE exam, which will be including 40% of your total weightage of your exam. Yeah, so that's all about PGD Prosto, and I would like to stop my share screen now to have some question answer sessions. Abhishek.
Thank you, Praveen, for your summary about PGD Pros, and looks like a very interesting program for all of us. I would be happy to see some questions, and if there are no questions, because I'm seeing the Q&A panel, I think the participants are a bit shy to ask questions. So I can ask you a few questions on their behalf as well. So it is a Prosto diploma. So may I know, will the participants be learning about the smile design and the full mouth rehabilitation?
Yeah. So like I mentioned earlier, Abhishek, we have 6 different models, and module 1, 2, and 3 are more towards the small arch or partially edentulous cases, and then module 4 will be complete edentulation, and 5 will be multidisciplinary approach and all. So as you see, the whole prosthodontics is covered in here, and smile design definitely not a separate part as such. If the patient requires that particular treatment modality, we definitely have some components of theoretical aspects and then the technical aspects of smile designing, and somebody who have a patient about smile designing, they can easily perform the clinical sessions as well, clinical procedures as well. under this program.
So will you be training us as a participant? I'm behaving like a participant here. So will you be training the participants about how do they need to record these cases and make their portfolio or a logbook, which can be very helpful in their future?
Yes, so case portfolio is actually a basic of this program, because you will be working as a flexible module. You will be working either in IMU or in your own clinic or both. And this portfolio of clinical cases, we do have a definitive guidelines prepared for us, for you guys to. So we do have a structured format and structured templates for preparing your logbook, preparing your portfolios, and submitting your actual case reports as well. So all templates and everything will be given on a day one, so that you can start preparing from day one.
And my last question to you is, do I have any facility or a flexibility in payment? Because we do understand it's a 1 year program. So if there is a flexibility in payment, especially in the installment plans, so do we have any flexibility in paying for the course?
Yes, meaning I think marketing will be, or the department will be really giving you a bit detailed information about that. But like the payment will be or can be paid in 3 to 4 installments, if I'm not mistaken, 2 to 3 installments, definitely throughout the period of 1 year. So they do have some payment plan as to follow for the participants if they want to pay it in part.
Yeah,
Yes.
so thank you, Praveen, for giving a very clear presentation about postgraduate diploma in prosthodontics. And we are hoping that the participants, those who have joined us today, they can get some benefits out of it. And they can, if they have some more questions, we'll be happy to have their questions in the end of the session as well. So thank you so much once again. And now I would like to invite our third speaker, who is Dr. Ranjeet Bapat, and who is the lead for Postgraduate Diploma in Implant Dentistry. So Dr. Ranjeet Bapat is a periodontist and implantologist, and he's been running this PGDID, which we call it in the short form, for quite some time, and he's quite experienced in running this PGDID. So Dr. Ranjeet, I welcome you, and you can take over the presentation now.
Yeah, thank you, Dr. Abhishek. I'll just share my screen. Okay, good evening, all the participants, and I'm Dr. Ranjeet Bapat, and today I would be taking you through the program of Postgraduate Diploma in Implant Dentistry. We have also invited our alumni and the current student batch who would share their experiences about the program. And we also have Dr. Ms. Elaine from Nobel Biocare, who's our industry partner. Yeah. So just to take you through, I am Dr. Ranjeet, and I have done my master's in periodontology and implant dentistry long back in 2007. And I have achieved implant fellowship from Indian Society of Oral Implantology. And I have been working as an academician and as a clinician for the past 13 years. Currently, I am working as a program director for the PG Diploma program for implant dentistry in IMU. So just to take you through about the program, this program basically currently we are running the 4th batch. Yeah. So already the 3 cohorts they have graduated, and the 4th cohort is currently is pursuing their education in IMU in implant dentistry. And the program covers basically right from the basics of implant dentistry up to the advanced and complex cases. Yeah. So we do train and provide the knowledge based about fundamentals in implant dentistry by face-to-face lectures and online lectures, and also have different case scenarios where the students they try to develop the critical thinking in terms of planning a case and a variety of cases pertaining to implant dentistry. We also have before the students actually perform the implant placements and the restorations in the clinical practice, we do train them with the hands-on sessions in our preclinical labs. on different techniques like implant placements, bone grafting, and impression techniques, yeah, and certain advanced cases like sinus lifts. So basically, taking you through the structure, how the program is being structured. So the program is basically structured so that it's as same like endo and prosto. It is a flexible program where it is basically designed for the general practitioners who can devote their some part of their time schedule for this program, where they come in for a few days to IMU and they train themselves through different courses. So we have different courses. We have 6 different courses delivered over a period of 1 year. So we will train through all the basics and advanced cases of implant dentistry during this 1 year program. And same like endo and prosto, we have different face-to-face and hands-on sessions, online activities. We also have certain quiz and online CBLs. You can also discuss your cases with us from your clinics, where we have dedicated supervisor for each and every participant who joins this program. And then you can discuss those cases with the supervisor and arrive at a treatment plan before you start placing those implants in your clinic. Yeah. And also we have facilities in IMU. So IMU also has all the dedicated facilities for placing dental implants. So we do provide initial first few cases for the students to place under our vigilance. So once we are confident that the basics of implant dentistry by placing first 2 or 3 implant cases, then we allow you to be flexible enough to practice your cases in your clinic under external supervision. So we also have identified certain external supervisors from private practitioners whom you can contact and arrive at a treatment plan with them and then place under their vigilance in your clinic for your implant cases. So how the program has been planned is we have 6 courses which have been approved by the MQA, and we start with the basics, fundamentals like your infection control, then your anatomy, what are the different implant systems, what we are based on the evidence-based practice, what we do in implant dentistry. And then we slowly move towards partial edentullism. So how are you going to plan a case with a few missing teeth? How will you plan in terms of soft tissue analysis, hard tissue analysis, adjacent anatomical landmarks? Yeah. And then we have from partial, we go towards complete edentullism. So when you have full mouth, complete edentullism, how do you plan for implant supported overdentures, implant supported fixed prosthesis? Yeah. Other than that, we also have currently we have undergone curriculum review, and we have tried to, based on the feedback from the stakeholders, we have tried to also incorporate entrepreneurship, learning outcomes in our program. The reason is because in this competitive market of implant dentistry, we need to know certain tips and tricks on how to increase the footfalls, yeah, for your implant cases in your clinic. So we have tried to incorporate these learning outcomes in terms of developing entrepreneur skills and developing your communication skills. Other than that, as all of us know, complication is a part of each and every dental treatment what we do. So also how to handle the basics of managing implant complications in terms of the surgical complications, in terms of the prosthetic complications. Yeah, we also see to it that we help the students even though they after the graduation, if they come with the cases to our clinic, we try to resolve those complications by discussing with them. So we do also provide after graduation this support in terms of helping you out in planning as well as handling the complications. And other than these, we also have dedicated implant practice 1 and 2, which are pure clinical courses, and you do come to IMU and you do your cases on your own. Yeah. So to guide you through to the journey for implant dentistry, we have experienced staff. We have Prof. Do with us, who is quite a experienced faculty in terms of her skills for implant dentistry and prosthetic dentistry. We have Dr. Naresh, who is also an examiner for Royal College of Edinburgh Implant Dentistry Program. We also have Dr. Praveen, who is also the examiner, and they are well trained in guiding you all for your implant dentistry courses. Also, we have Prof. Siao, who's a prosthodontist and who's also experienced in restoring the implants which have been placed. Then we have Dr. Rohit Menon, who is also a prosthodontist, and Dr. Shivani, who's also a prosthodontist. Other than that, we also have Dr. Swarna, who is a radiologist and who will help us in planning the CBCT and guided surgery planning. So we also do train the students on guided surgery implant placement. So we have the software and also the relative infrastructure in terms of planning the cases and do for guided surgery implant placement. Yeah. So as I said, the facilities IMU is well equipped with the oral surgical and the implant surgical procedures. We have all the dedicated infrastructure in terms of implant dentistry. We have world-renowned implant systems with us, which you can come and get at a full-fledged exposure in placing those different implant systems in IMU clinic. We have the necessary software planning, as I said, DTX Studio by Nobel Biocare, where you can actually plan and then utilize it for placement of the implants on the patients by your computer-guided surgical procedure. We also have introduced ITI Online Academic Campus. This is something which is quite fruitful in terms of gaining a good amount of exposure in your clinical practice. ITI is basically International Team of Implantology, which is a world-renowned private organization. So we have gained access to their online webinars, reading material, lectures from different various speakers. So for the students who register under this course, the ITI Online Academic Campus is free. It comes as a complimentary package with the course. So you can, till you are the student in IMU under PGDID, you can avail these facilities of ITI Online Academic Campus. Coming to what assessment. So as you say, assessment drives learning. Yeah, assessment drives learning. So we have different types of assessments. We do train you to develop your own portfolio. Yeah, so how you design your portfolio, and this portfolio is going to help you for your further, if you want to avail fellowships of other from Edinburgh or from any other societies, this portfolio is going to help you to achieve those extra degrees for your own benefit. Then we also help you to guide towards case report, how you exactly formulate and document a case report. Yeah, because this documentation is the most important thing in clinical dentistry, which most of us lack as clinicians. So we will guide you on how to document the case reports in terms of your every case, how you take the photographs, how you document all the findings, then how you document the radiographs, how you pen down your reflection. So you have a full-fledged report of each and every patient, which is also going to help you from your medical legal point of view for if any complication arises. Then in terms of your assessing your cognitive skills, we have one best answer and short answer questions, which is quite simple. Most of you, you fare well in these assessments. And we have, and just to test your knowledge, we have objective structured clinical examination, which is OSCE, where we throw certain different scenarios to you, and then we test you, how do you fare well in terms of your understanding of what we have taught you. So this is how exactly the program has been structured, so that you come for a few days in IMU, you imbibe all the knowledge what we impart to you, and then you take back, you can practice in your clinic, you can get your cases to IMU, and at the end of 1 year, we see that you have gained sufficient amount of knowledge in terms of implant dentistry to take it as one of the important aspects in your implant practice and your clinical practice. Yeah, that's it. Yeah, thank you so much. If you have any questions, I can answer those.
Thank you, Dr. Ranjeet, for your presentation. And we can see the amount of work you have done in last 4 to 5 years, especially in running this course. And it's running very well. I'm the witness for this particular course. So yeah, so again, I have a few questions for you on behalf of the participants. You had mentioned that this course is for 1 year, and this is quite close to a course which is implant dentistry course, which is Royal College of Surgeons affiliated by Edinburgh. So will the participant be eligible to get the diploma in implant dentistry, which is PGDID, from the Royal College of Surgeons Edinburgh, since this program is benchmarked to this particular qualification?
Yeah, Dr. Abhi, thank you for the question. The program has been structured. The curriculum has been planned on the gold standards of Royal College of Edinburgh program. So the learning outcomes what we will be covering will be similar to those which have been covered by the Royal College. Although even though you graduate from PGDID course from IMU, you still need to go and get the Royal College exam separately. You won't be getting a diploma immediately if you get a diploma from IMU. So you need to follow their protocol, go there, give their exam, and then get the separate certificate from their course. The benefit of joining this course is if you graduate well within 1 year, it will help you to develop your own portfolio, which is similar to that of the Royal College. So eventually a year later after this program, you can virtually actually appear for the exam and clear those exams. And since we also have Dr. Praveen and Dr. Naresh who are on the examination panel of these of the Royal College exam, the students are welcome enough, to take the guidance under these two.
Yeah, that would be great if you can guide them to and prepare them for the examination, and then they can appear for the Royal College exam, because that will give a bit of confidence for them to appear for the exam. And if they clear the exam, then it is going to be quite nice for the course as well.
Absolutely.
So, okay, thank you so much. So may I ask you another question? What implant system are you using, and will the participant be using it?
Yeah. So the program has been structured based on the evidence-based implant practice. So we have done a lot amount of survey, and we have narrowed down to 3 systems what we will be giving the students the exposure on. That is Nobel Biocare, then Astratec and Zimmer. These are the 3 implant systems the students will be trained on, and then they are free to choose whichever system they are comfortable with and place the implants.
Okay, I have another question for you. If they need to treat any patient who require dental implants at IMU, would that be possible? That is one. And the second question is, will there be any arrangement and the cost for the patient, and how it's going to be delivered to the patient?
Yes. So as I said, initial first 1 to 2 patients at least we will provide for the students to kickstart their implant journey with us, so that we also get to know at what levels of skills, the basic skills, surgical skills, what the student has. Depending on that, we will see if the students is well versed with the basic surgical skills, then the students will be allowed to do the cases in their clinic. Other than that, especially for PGDID students, we have a discounted offer for the patients undergoing implant treatment under the PGDID course. So the patients who have registered under PGDID course will be getting 50% discount compared to the specialist cost what we charge. And this is for the first 4 cases. For example, if I do my first 4 cases on IMU, my patients will have a lot of benefit in terms of the costing for their undergoing their implant treatment. And after that also, the remaining few cases also what they do, again, it is still at a bit more discounted compared to what the specialist charges are. So whole and whole, the patients are at benefit as well as the students, because the students can place the implants under subsidized cost for the patients.
I think this is going to be quite beneficial for the patients as well. And you will be able to have a lot more patients coming in and looking for the postgraduate students because of the reduction in the prices.
Yeah,
So,
absolutely.
So may I ask you a couple of questions? One is how many clinical cases they need to perform in the program, and what complexities, like what level of complexity of cases they'll be performing in the course?
Yes. So currently during the curriculum review, we did take a feedback from the students and from the stakeholders, and the current practice is the students need to finish 6 complete cases. That is right from the start of implant placement till they restore. Yeah, and its cases is not implants. So example, in one patient, if there are multiple implants, then it is still considered as one case. So they need to restore, they need to place those multiple implants, restore them. That is their case 1. Then case 2 may be 1 implant or 2 implants. So like this, they need to finish from start to end 6 complete cases. Other than this, these 6 cases, they need to plan 10 implant cases, treatment plan, and need to get them approved from the supervisor, so that we know that the planning is correct. Then only they can execute it well. Yeah, that is what it is. And what is the second question, Dr. Abhi?
The complexity of the cases. What level of complexities they can finish in their course?
Yeah, the students are trained to do straight to advanced implant cases as per the ITI classification. So here we follow the ITI classification of straightforward, advanced, and complex. So we do allow them to perform the straightforward and advanced cases on the patients, but for the complex cases, it is done under the guidance of the clinical supervisor. For example, complex, it means there is a direct sinus lift surgery. Then we don't allow the students to perform the direct sinus lift surgery on their own. We have a supervisor who will guide them and who will do the sinus lift surgery for them. But implant placement in those cases again will be done by the students. Yeah.
Thank you so much, Ranjeet. As you rightly explained, I have seen the close supervision of the supervisors while performing the implant surgery, especially by the postgraduate students in previous years, and you will continue doing so. So thank you once again. And now I would like to invite our industry partners. So let me introduce again. We have three industry partners for three different programs. So we have Zeiss, and we have a representation from Zeiss, Ms. Denise T, who is our industry partners for postgraduate diploma in endodontics. We have another industry partner for Prosthodontics, which is from Dentsply Sirona, and Cheryl Wong is representing the Dentsply Sirona for us today. And the third industry partner is for postgraduate diploma in implant dentistry is from Noble Biocare, and Ms. Elaine Tan is representing. So may I request Ms. Denise T, who is the industry partners for us for postgraduate diploma in endodontics. And personally, I have been working with her for last 8 to 9 years, and she has been quite a good support for all of us, and all the courses what we have run in IMU. They have supported us all the time. So Denise, thank you so much. And I would give you the platform for you to share your experience and presentation. Thank you.
Sure. Thank you, Dr. Avi. Thank you, IMU, for inviting me to join this webinar this evening. I will share my screen. Okay. So, yeah. So I'm Denise, representing DMAT Solutions, and DMAT Solution is the distributor of Zeiss dental microscope since 2013. Yeah, 2013, yeah. So Zeiss is a brand from Germany, headquartered in Jena, Germany, and Zeiss also have its direct office in Malaysia. For more than 100 years, Zeiss has been driving progress in medicines. So they have a wide range of products for different applications, and the dental surgical microscope is one of them. So the dental surgical microscope is designed to illuminate and magnify the surgical area and to support the visualization of surgical procedures. So a bit of history of the surgical microscope. The very first microscope invented by Zeiss in 1953. The model is called Opmi 1, and it was used for ENT surgery at that time. And the use of the microscope then quickly followed by other specialties like ophthalmology and neurosurgery. And the use of microscope in dentistry is not happened until 1990s. And Dr. Shinok Kim, who is the well-known endodontist in US, are among the few who use the microscopes in the practice in 1990s. And at the time, mainly the use of a microscope is confined to endodontics applications. So Zeiss, as the pioneer in the dental microscope industry, has been continuously doing R&D to improve the product. And in the latest, for example, in the latest model Extaro 300, we have these functions, we call it fluorescence mode. When it is activated, it can help to detect the carious tissue. So the red color things that you see in the screen is actually a carious tissue. So the dentist can actually excavate the carious tissue under the microscope visualizations. And also the fluorescence modes can help to differentiate the natural tooth tissue from the composite they used before. So with this, it can help to save as much healthy tissue as possible and also save times of the dentist. And in this model also, Zeiss have the built-in HD camera, and all the image and the video you can direct connect, wirelessly connect to the iPad via the Zeiss Connect apps. So this helps the documentations and also the communications with patient easy. So in the 21st century, Microscope play a very important role in the daily practice of endodontist. In the past, root canal treatments was performed predominantly by feel, but now with the aid of microscope, the structures, complicated structures of the root canal system can be seen clearly, and the treatment can be carried out with more precision and predictably than ever before. So microscopy in endodontics has become a way of life. Nowadays, we also see the microscope is used by other specialty. So for example, restorative dentistry, implant, and also for periodontics. We do see getting more and more GP incorporate the microscope in their daily practice. So among the benefits of using microscope, so of course the first one is the magnifications. You can only treat when you can see. So when you see more under the microscope, and you can treat more. So complicated procedures like instrument removal, retreatments, calcified canals, all these can be done under the microscopes. This slide shows the details that you can see under different magnifications. So a microscope can give you up to like 21 times magnifications, can really see deep down to the canal. Studies show 60% of dentists suffer the neck and back pain, and 30% of them may retire early due to this problem. And can see from the pictures, dentists with without any magnification aid, they tend to bend and get closer to the patients. And dentists with the loops, so is the posture slightly improved. Then, but with the under the microscope, using the microscope, the dentist can really keep the posture upright and working comfortably for 8 hours or more a day. Yeah. So microscope helps to improve the ergonomics. The third one I would say is the visualizations and documentations. So with the HD camera integrated in the microscopes, you can show patients what you have done, what is the diagnosis, and after treatment results. So pictures is worth 1,000 words. And this will improve the communication with patients, and patient will have more, is more convinced, and also the confidence increase as well. So quality products, excellent after sales service is the promise of Zeiss. And in DMAT, we cannot emphasize more on a long-term partnership with our customer. So it's our pleasure to be the partner of IMU all these years. So I have some gallery to show that we have these workshops in 2017, where Dr. Abhishek always the one who contacted me, and then we send in our microscope to support the workshops. It's really our pleasure to be part of the team. Yeah, then we have in 2018 we have another workshops. Professor Dr. Shekhar, Dr. Abhishek is there, and with the participants. 2019 we have 2 workshops I remember in this year. Then always get a good response from the dentists to join the workshops. And last year, 2020, with the mask on and the training continue. So thank you. That's my presentations, and thank you for listening. I have a present for all of you. And this is the one, the Microscopic Dentistry Practical Guide. So this is an ebook developed by a group of dentists, published by Zeiss. So inside you can see there is many topics about the microscopic dentistry, the use of microscopes, and what are the things to take care and to pay attention to in different applications. So you can get all the information from this 200 pages ebook. So whoever interested, you can email to admin@dmat.com.my, put on the subject as Zeiss microscope, and I will be happy to share with you this ebook via the email. Okay, that's all from my side.
Thank you so much, Denise. I mean, your ebook is really a gift for us, and I can really see it's very microscopic. So we need a microscope to read this as well. Yeah, and what you rightly said, you really cannot read what you can't see, and we have been following this this mantra, I would say, in our clinical practice. Thank you so much for supporting us all the time, and for the participants, I can tell you all that we do have facilities of microscope in the dental clinical center. I mean the dental skills center, where we do preclinical exercise, and we do have microscopes in the clinics where all the participants, those who will be joining us later, they can actually come and do their patients under the microscope. And we have been using the microscope for many years, all the team members, especially in endodontics. And it is a different ball game when you do root canal procedures or any endodontic procedures under the magnification and illumination. So thank you so much for your support and your beautiful presentation.
You're welcome.
Yeah, and I'll be happy if people do have any question for this. So if no questions are coming from that side, I don't know why are they so shy. But may I know? Suppose if we are not very comfortable in under the microscope, so how can you help us to improve our skills in using the microscope? I mean, definitely we'll be helping them as well. But what support the Zeiss people can give for their training?
Okay, so you mean for the PG course?
For the participants, yes.
Oh, okay, for the participant. Yeah, usually we will conduct the workshops for those who are interested to learn more about microscopes, like 2 times a year. And then like for example, if the IMU workshops, we will be glad to support those our user to participate in the workshop and learn the skill on operating the microscopes.
Okay, thank you, Denise, for your presentation, and we will be looking forward to see you again. So now we have another industry partner for PGD Pros, which is Postgraduate Diploma in Prosthodontics. It's from Dentsply Sirona, and the representative is Ms. Cheryl Wong. So Cheryl, can you, yes, she's here.
Hi.
Hi, Cheryl.
Yeah, hello.
Yeah, hi.
Yeah, let me share.
So Cheryl is from Dentsply Sirona, and Dentsply Sirona is also supporting us in endodontics as well, and they are supporting in prosto as well. And again, as I mentioned about Zeiss, Dentsply Sirona has been a partner for us for many years. So Cheryl, I leave it to you now, and you can go ahead with the presentation.
Okay, thanks, Dr. Abhishek, and thanks, IMU, for giving me a chance to speak here. Okay, let us start with our company mission and vision. Our vision is to empowering dental professionals to provide better service, faster dental care. And our vision is delivering innovation dental solution to improve oral health worldwide. Our products make a difference of the life of over 6 million dental patients every day, helping them eat, speak, and smile with confidence. Dentsply and Sirona joined force in year 2016 to become the world's largest manufacturer of professional dental solutions. Our trust brands have empowered dental professionals over 100 years. Now working together under one brand globally, we are dedicated to continue this journey for many years to come. We are committed to using our combined resources to continue driving innovation and helping dental professionals achieve more than ever before. We created CEREC over 35 years ago, and we are the first company to introduce treatment center, first electric dental drill, first dental x-ray, and also introduce first low-profile bracket system. As a global technology and innovation leader, we spend over 125 million every year in our R&D, and we have over 600 scientists and engineers. Over the years, we have built broadcast clinical education platform in the industry. The Dental Sirona Academy educates over 350,000 professionals annually. We conducted almost 11,000 courses in over 80 countries. We have been driving CADCAM innovation for over 35 years. CADCAM enables dental professionals to provide patients with restoration, including inlays, onlays, crowns, bridges, and veneers in a single visit. Our solution also enables them to take digital impression and produce surgical guide. Our CADCAM solution include scanning, design, milling or grinding, sintering, and glazing technology, as well as the largest possible variety of materials. They are used to complete a restoration somewhere in the world every few seconds. We also provide standardized system technology with seamless digital workflow, and our in-lab solution make exchanging data and information between the practice and the dental lab. This study published by CEREC Asia in year 2019. In this study, our PrimeScan and OmniCam classified as Class A because Dentsply Sirona offer our own scanner, CAD software, and CAM milling machine. Okay, and after the testing and study, they found that PrimeScan has the highest scanning efficiency. The scanning speed is the faster, data capture also faster than others. The AI is amazing. It's able to fix soft tissue and other mistakes. Other than CADCAM, in our Dentsply Sirona product portfolio, we offer complete endodontic solution as listed in this slide. We have files, and then we have some tools and small equipment as well. For restoration, we also do offer a complete direct solution and also indirect solution. Last but not least, in Dentsply Sirona, we also have our own implant system called AstraTech implant system. Okay, that's all for my side. Thank you very much.
Yeah, thank you, Cheryl, for your brief presentation about Dentsply Sirona. Thank you for your support. And hopefully participants can get some idea about the products and the materials what we'll be using in our day-to-day clinical practice as well as the preclinical exercise. So thank you for supporting and being our industry partner for postgraduate diploma and prosthodontic courses. So now I would go for the third presentation from industry partner, which is for postgraduate diploma in implantology, which is Noble Biocare, and the representative from Noble Biocare is Ms. Elaine Tan. So Elaine, can I request you to please start your presentation and brief all of us about the support, what you have been providing, and something about Noble Biocare.
All right, thank you, Dr. Abhishek. So sorry, I couldn't share my screen. Shelley, would you mind to unshare yours?
1 minute, let me do it.
Thank you.
Sorry for that.
Thank you, Cheryl.
Is it okay?
Yes, Cheryl. Thank you.
Well, should we jump to the Q&A, which is not true? Hi, thank you, Dr. Abhishek, and also thank you, IMU, for the invitations. Good evening to ladies and gentlemen. This is Elaine. I'm actually the sales account manager in Malaysia for Noble Biocare. So why Noble Biocare system? Noble Biocare is about you for your patient. That is our promise. So our promise is actually based on over 65 years of research and development in implantology, ever since Professor Bromak's groundbreaking discovery of osseointegration and first ever dental implant treatment in the world. But we never settle for the status quo. We follow no one. So from this slides, you can see that how much of innovation products that we're actually producing throughout the years. So I would say that Noble Biocare is a bold innovator to very core doing whatever it takes to improve the possibility for the professional to treat more patients better. Noble Biocare is also a world leader in the field of innovation, implant-based dental restorations. Our goal is to empower the dental professionals to give quality of life back to the patients. So how can we support our customers, or how can we support the dentist? So Noble Biocare support our customers through all the phases of professional development, offering the world-class training educations along with the practice support and the patient's information materials. Nevertheless, the company's headquarters is in Zurich, Switzerland. The productions will take place in the 4 sites located in the United States, Sweden, and Japan. So most importantly, our products and the services are available in all over 80 countries through the subsidiaries and distributor in the world. So in another of saying that We are an established more than 50 years international brands, and we are available in the worldwide to provide the support to the dentists for their patients better. So this is our company's portfolio offering the solutions from single to fully edentulous indications for the dental implant systems, include the key brands called Active and Parallel, a comprehensive range of high precision individualized processes, and a CADCAM system like called Persera, the digital solutions for the treatment planning and the guided surgery called the DTX software. Besides all this, we are also currently entering into the implant navigation system with the unit called X-Guide. That will be a very interesting part. So in a nutshell, I would like to conclude that Noble Biocare is definitely one of the most innovation, R&D, and with all the clinical studies, proven dental implant company. So we are glad to be part of it with IMU, with one of the leading dental schools in Malaysia, to provide the best education to the dental practitioners. So I'm quite excited and hope to see meeting everyone during the IMU PG DID course in the future. Thank you so much, Dr. Abhishek.
Thank you, Elaine, for your very quick and clear presentation about Noble Biocare. And yeah, I mean, I know you have been supporting us for many years now. And hopefully we can see you more often supporting us in the same manner. And we all can go hand in hand as well. So thank you for your presentation. And now we have finished our presentation from industry partners. And I would like to give you the real experience of our students and the alumni, those who have been here for some time, and especially for postgraduate diploma in implant dentistry, because this year we are launching a couple of programs, which is PGD Endo and PGD Pros. So PGD Endo will be launched in April and PGD Pros will be launched in June 2021. However, the PGDID, we have been running it for some time now, and that is why we have a student who is currently pursuing the program and another one who is an alumni. So may I request Dr. Karthikeyan, who is a student who has been pursuing PGDID here. So Dr. Karthikeyan, may I request you to share your experience with all the participants?
Can I get my video open?
Oh, yes, please. Thank you for your time and efforts.
Yeah. I can't see my video anyway. Well,
okay. Can you switch it on, please?
Yeah, I've switched it on, but I don't see that you cannot start your video because your host has stopped it.
Oh, okay.
Okay. So I need an access.
All right. Okay. You can share your experience.
All right. I did my PGDID in 2019. That's why we call it as PGDID 19. All right. I'm not going to talk about IMU much. I'm going to talk about my experience with IMU. All right. So basically, nice. So basically, okay, guys, it's very simple. All right. You got a platform. All right. That is your dentistry. Okay. You need to learn your skills, how to plant a tree, or you want to cut a tree. All right. You can't just chop it, or you can't remove it, or you can't plant one. Okay. So what I've learned from IMU, even though I was practicing implantology, even before joining IMU, that means I'm like a weekend warrior. Okay. But what I learned is it was an eye opener for me. Okay. That is, how you say, I basically started seeing reality, how the world is progressing. I'd rather give an engineer or a contractor who has a license to build my house rather than a contractor to build, you know, just a normal village contractor to build. Build the whole house. All right. So this is what I learned, but I'm not going to talk about any products or any sales marketing over here. Okay. From the day I went, I was surprised that IMU has delivered a lot to me. They taught me more than what I'm supposed to realize. That means basically they teach you from the basics. They start guiding you from the basics. Even though they have like 3 reliable prime companies which they do implants with. So I deal with some other implant companies along with Nobel, but they do tell me that whatever you're doing is the same way how you're going to do it, but do it in the right way. And they are just a guide. And they're going to help you furbish you. That means if you're doing good implant, they'll let you do a better implant. That is how they've guided me. So that is why I'm over here to actually talk about. So, and they have gone beyond their time. They don't work from 8 to 5, but you can see now they are around 9, 10 p.m. They're still conversing with us. So sometimes when I have complications, even though I'm a student, treating my own patients not relevant to IMU, I do call up my professors to consult them. So that's how much I can tell about what I've learned from there. I've learned a lot, but I can tell you that much is my experience. You know, so it's not about the product, it's not about IMU, but basically the education that you're going to receive is going to be overwhelmed. You are going to be overwhelmed, and it's not going to be a waste of time or waste of money. That's it, Dr. Abhishek.
Thank you so much, Dr. Karthikeyan, and I must echo your voice. And let me tell you that I mean it's very encouraging when you are saying about all of us as a part of the IMU team. But let me tell you, IMU in general, IMU is the one who is showing us these values, and yes, yeah. So I mean this is the trend what we follow in IMU, and honestly speaking, when I see my bosses. Okay, when I see them working hard and towards, when we have seen one goal and we are trying to achieve one goal, especially when it comes to educating our students, I would say even a last person in IMU would do the same thing. So thank you so much for your positive feedback and a fantastic report about us. And it's very, very encouraging for all of us as a part of IMU. So thank you so much. Yep. So now we have the last presentation from the Dr. Karpaham, and I would request Dr. Karpaham to talk about the PGDID as an alumni.
Good evening, everybody. My name is Dr. Karpaham. So when I joined this course, I realized that this was the only accredited course in Malaysia for the postgrad diploma in implantology, and that made me want to join this course because they had a very good structure. It was well versed, and once I started the course, I realized that most of the lecturers, actually all of the lecturers, were very helpful. The course was designed in such a good way that I benefited from it in every module that I walked past by, from the first module to the 6th. Along with the module that it was well planned, I think the facilities in IMU, such as the library, the e-library, the lecturers who were giving guidelines like an e-books to us, I think overall IMU has done such a good job in coordinating a program like this. Instead of weekend courses, the fact that I joined this postgraduate diploma was more meaningful and educational to me, because now I know how to practice the right way, how to do implantology the right way. So in a summary or an overall experience, I would recommend this course to anyone who is serious about doing implantology or wants to venture further in further education, not just implantology diploma, but all the other diplomas as well. I think it's a good course to look into.
Yeah, thank you so much, Dr. Karpaham, and thank you for waiting for so long. I know you must have had a hectic day throughout the day. You've been working, and
Yes.
yeah, and then you have been. Thank you so much for accepting our invitation and sharing your experience. So we are almost at the end of our webinar. I know it was supposed to be from 8 to 9 and it is almost 9:15. So if I do have any, I don't see any more questions, but if you do have any questions, you all know the contact details of our the marketing side. So I'll be very happy to take your questions and answer your questions from all of us as a part of the team. So yeah, do we have any question? Okay, so I don't see any question in the chat as well as in the question and answer panel. So if we don't have any question, all the participants, you know IMU, you have all the email IDs, and we'll be very happy to answer your questions whenever needed. So with this, I would like to say thank you everyone, all the speakers and the industry partners and the students and the alumni, and especially the IMU marketing team and the postgraduate department of IMU as a university for conducting this virtual talk show for all the participants, future participants, and giving a bit of idea about the postgraduate courses, what we are running in IMU School of Dentistry. So thank you once again, everyone, and good night, and stay safe, and hopefully to see you soon.